We are live with another episode of the Rebel Health Spotlight. I'm here with my friend who a lot of you probably know, Dr. Christine Schaffner. Dr. Schaffner, thank you for being here.
Oh, thank you so much, Michael. I feel like we already did an interview before we got on, right?
Yeah,
It's
yeah.
always it's always fun connecting with you.
These are the highlight of my day. So I like to do these interviews because it's with all my friends. And yes, I should start filming the pre-filming
Uh,
conversations as like a behind
yes,
the scenes or like outtakes or something. But
that would be really good.
um, Dr. Schaffner's been on a few of our master classes. I think I was on her podcast. She's been doing incredible work for quite a long time in this field. Recently had her own brush with a really serious health scare last year
Yeah.
and has really opened up and sharing about that too. And our audience does consist of a lot of people with like complex chronic illness, which I guess is exactly how I would peg your avatar patient who
Yes.
comes to see you. So I'm not going to give away too much. If you could just share a little bit about yourself and your work and what you're currently doing, and I'll ask you some follow-ups to that.
Yeah, absolutely. And yeah, thank you for having me on. And you're exactly right. I've been doing this work for a little over 13 years now. And my avatar, the people that I serve, my patients are those who are struggling with complex chronic illness. So people who just, the conventional paradigm doesn't have a language, how to treat these multi-systemic, multivariable root cause, pictures, right? And so I see myself often as a detective. My patients teach me every day. I've been on a journey through just my own curiosity with how to really help people get diagnosed more quickly. Also, to create, part of the problem with chronic illness. There are many problems, of course, but what the system is, it takes a long time for people to figure out what's wrong with them. That is getting better with all the education out there, but it's still too long. And then it's too long once they get on their healing path to recover them. And there's a lot of just maintaining and the expense and all of it is a lot. And so I've always kind of made it my mission statement that I'm in search of the most elegant path for healing, meaning like what is the shortest distance between two lines. And can we bring in this emerging, like, my passion and my curiosity and, is quantum physics and biofield science and looking at the field interactions of the body and, the power of, light, sound, frequency, meditation, and how do we not make that like an afterthought? Like, okay, this person has tried everything in the functional medicine world, and now like, okay, we got to get them meditating, and maybe that will help. It's like, no, let's start with this language of how we're wired to heal. And so that keeps me busy. And I have a practice in Seattle. COVID really launched me into doing a lot more telemedicine. So I have licenses in many states that naturopaths are licensed, but I mean, I'm happy to always do the work on Zoom, but there's nothing like being in person with somebody. And we use like a lot of bioenergetic tools, a lot of functional medicine, bioregulatory medicine, muscle testing. We do scar treatments and ozone and laser intravenous therapy and lymphatic work and sound healing. And, we just put it all together to create a shift and a transformation for people that they can, maintain and learn from and, have an experience, a continued experience in their home environment as well.
Well, thank you for sharing that. I know a lot of practitioners aren't used to being put on the spot to give their own bio and work description. So I've had a few people kind of squirm when I ask them that question because they're used to
Yeah,
just sitting there and zoning out while somebody introduces them.
yeah,
So
yeah, yeah.
no, I love the way that you work in that you incorporate so many of those things that you mentioned. And I'm currently recording interviews for an event that you're going to be part of that we're recording soon that I'm co-hosting for Health Means called Beyond Functional Medicine. And
Yes.
we're talking about all kinds of outside the box, different types of therapies or practices, or like it's really two tracks. One is more the mental, emotional, spiritual, energetic trauma that tends to get ignored in the functional medicine world, and not intentionally. They're just not trained in those things. And I don't think it's gone over like the Rubicon yet, where it's common knowledge of how much that
Yeah.
influences the illness or the wellness. And then
Agreed.
the other side is like cutting edge therapies or treatments or things that like most practitioners probably haven't heard about or seen.
Yeah.
And your practice is really unique, at least among practitioners I know personally,
Mhm.
in that you're really well versed in what I would consider conventional functional medicine, which is lab tests, supplements, protocols like hormone panels and all that kind of stuff. But also, even if you don't do the work, I know you used to have somebody in your practice who was like working with patients who was doing some sort of trauma work, like the
Yeah.
trauma, the energy, the somatic based stuff, the mental, emotional, spiritual trauma, nervous system side. If you don't do it yourself, you have practices or you have people that you refer to or work with. And then also, you've told me probably more about different kinds of treatment things and therapies that I've never even heard of. Like you mentioned scar treatments,
Yeah.
and you
Mhm.
said when you move to Italy, you need to go to Switzerland because there's somebody in Switzerland. Because I have a scar on the back of my head that was a normal scar for most of my life, just like a spot where there's no hair.
Yeah.
And then about 8 years ago, it became this like, I don't know, it becomes like a dry patch of skin and like gets, you can pick it and it's annoying. And you said you taught me a new term and you said, go see this person in Switzerland. They'll do some sort of injection and it'll do something. And so, like, all these therapies and treatments. So I'm curious, you started as a naturopath, like
Mhm.
like you went to normal naturopath school, just
Yeah.
like everyone else. Which
Yeah.
school did you go to?
I went to Bastyr, so that's why I'm
Okay.
still in Seattle. So I went to
Yeah,
Bastyr.
yeah.
Street.
Bastyr is really comprehensive. I actually went
Yeah.
through their I was registered at Bastyr in San
Oh,
Diego
okay.
at
Okay.
one
Yeah.
point. I
Yeah.
decided not to go through with it, but
Yeah.
I've been to the campus. It's a very thorough program.
Yeah.
But while naturopathic medicine is a little more holistic than what most people would think of when they hear functional medicine,
Yeah.
it doesn't involve tons of either of those categories of
Yeah.
things. So I'm curious, how'd you get from A to B of
Yeah.
practicing as a naturopath to being so outside the box?
Thank you. Thank you. So I really, it's kind of like, there was part of my life when I was in naturopathic school that there was one track I was like, well, maybe I'll do women's health. And then, Louisa Williams came to talk at a brown bag lunch, Dr. Louisa Williams, and she wrote a book at the time that was just coming out called Radical Medicine. And I remember just hearing her talk, and she just had this like, it was like this Bible for what is now like really well known or more well known as bioregulatory medicine of, this biological medicine, it was called at one time, that came from Europe. So it's like the Swiss, the Germans, the Austrians, but it's really an evolution of ancient principles and bringing in these concepts of energy medicine and bioenergetics and bioresonance, as well as a really big topic on what we call interference fields. And I remember she asked us all, like, what is the first thing you do with a patient? And we're like, take them off gluten, blah blah blah. And she's like, no, you look in their mouth. And we're like, what? Like most of their problems are in their mouth. And I just remember having that, like, knowing, like, whatever this woman knows, like, I want to know. I want to get to the root cause, beyond the root cause of why people are sick. And so I would just carry that book around me. I never read it cover to cover, but I've read, huge chunks of it, of course, but before the Kindle. So I would just like carry this book around me
Yeah.
by osmosis. And so that was influential. And then, I was able to work, from the, day one of becoming a naturopath with really complex chronic illnesses. And so when you work with that patient population, this was 13 years ago. In the last 13 years, there's been an incredible amount of allowing education to be online. Like I remember, it was just still fringy. You couldn't really put Lyme disease on your website. You couldn't
Mhm.
put like anything related to energy medicine on your website. It was
No, that's changed radically just in
that
the last like 5
yeah,
years.
yeah, totally, totally. So it was just a
Yeah.
very, very different,
Mhm.
underground network of, just
Yeah.
like, these clinicians who were seeing these patients. So if you have an open mind and, enough of a background, you can, help these people. And so my patients taught me, and they taught me a lot. And they taught me that trauma was huge. They taught me that interference fields absolutely do matter, and you have to clean up the mouth and clean up the scars. They taught me the importance of the lymphatic system, and that, again, another thing that's been wildly overlooked, but a lot more education now about it. But the lymphatic system is a huge system, especially in the chronic illness community. You know, it's that intersection between toxicants and trauma and pathogens that's stored in that space. And they also were highly sensitive. You know, the people who are chronically ill, if you can like really kind of look at your body is not broken, it's just, you know, sounding the alarm at a really toxic time. And they're highly sensitive. They're the canaries in the coal mine. So they're the
Mhm.
ones who I started hearing about electro hypersensitivity before we knew about it. The person who like needed all the cell phones turned off in the clinic, you know, before, and we're like, what's that? You know, and then the mast cell patients before they were mast cells that would take like one drop of something and like have an explosive reaction. We're like, how is that possible? You know, but you know,
Yeah,
you keep just, you know, you trusted the patient. And I always believed my patients, and I always trusted that they were telling me what was
that's
happening.
such a huge
Yeah,
thing. Like, I just want to pause
yeah,
there for a
yeah,
second because
yeah.
in the world of like complex chronic illness or things like mast cell or electrosensitivity or like those kind of things, a bunch of people have probably tried to make that person feel like they're crazy
Yes.
or like implied like you're creating this, that you're making this up or you're creating it or it's not real because they didn't know what to do about it.
Yeah. Yeah,
And
absolutely.
like I love your like honesty of, well, we didn't know what to do about it, but then you say, I don't know what to do about this. And then you find someone who does, or you find a way to work with it. Or like you mentioned, they're super sensitive. So then you discovered more subtle ways to work with
Yes.
people than putting like herb extracts that are 1000x in their mouth, right?
Yeah, yeah. I learned about dropping homeopathics in the belly button for some people, but not sometimes was,
Wow.
that was just, you know, you get creative and you just trust your patients. But, you know, those subtle fields and those subtle energies became more and more of an interest to me. And then, you know, my patients taught me like some of them would get a Rife machine, or some of them, again, we couldn't even say that word, you know, and then it just opened me up to, again, there's this whole body of knowledge. You know, there was electromedicine before the Flexner report, right? There is this, you know, of course, like ancient passing down of this knowledge of the subtle energies in the body, and that our body is truly like the biochemistry is so fun and satisfying. It's always great to get a genetic report and think you're going to change the SNP with
For the
magnesium.
Western mind, like
Yeah,
for the,
B6,
yeah.
you know, and like that's it. But then you're like, well, no, like family constellation's really gonna change that epigenetic
Yeah.
expression. And that B6 actually doesn't really matter
Then it
that much.
renders that genetic
Yeah,
variant really
yeah,
irrelevant if it's
yeah,
not expressing. Yeah.
yeah, yeah. So then, you know, you start, you know, just seeing. And so I was around a lot of, you know, people that you know, were, you know, I worked with a team at that